5 minutes. Ms. Miller-Meeks.
Thank you, Mr. Chairman. Mr. Secretary, you testified before this committee back in March. At that time, several members, including myself, asked you about COVID-19 testing protocols at the southern border. You said, and I quote, "We do support the testing of individuals, and that is indeed our policy, and we have implemented practices to execute on that policy." However, on September 10th, the DHS Office of Inspector General came out with a report that stated CBP does not conduct COVID-19 testing for migrants who enter CBP custody. And indeed, that's what I found at the 2 trips I made to the border. Instead, CBP relies on local public health systems to test symptomatic individuals. According to CBP officials, as a frontline law enforcement agency, it does not have the necessary resources to conduct such testing. I don't have to tell you that we're in a pandemic, Mr. Secretary. And I believe that testing of people coming across our southern border is one of the many keys to controlling the spread of COVID-19. That is why back in March, I introduced my first bill, the REACT Act, to require COVID-19 testing for all migrants. The OIG recommendation coming out of this September 10th report said DHS should reassess its COVID-19 response framework to identify areas for improvement to mitigate the spread of COVID-19. The report went on to say DHS leadership must commit to strengthening these COVID-19 preventive measures. Without stronger measures in place, DHS is putting its workforce, support staff, communities, and migrants at greater risk for contacting the virus. Additionally, with the predictable surge of Haitian migrants from South America, they may bring with them the Lambda variant, which is in South America at this time. These are certainly strong words coming out of the OIG. Additionally, the report makes observations regarding lack of social distancing, lack of mask wearing, and general overcrowding in facilities at the southern border, which would all combine to facilitate the spread of COVID-19. And not only COVID-19, I understand there is a measles outbreak at Fort Bliss. This is a huge problem and one that the committee has been trying to get answers for during this entire year. And every time we ask the question, I feel like we get a different response. So I've got a number of questions, and because time is limited, I'm going to run through them so that you can answer them. If we're requiring air travelers to have a negative COVID-19 test before entry, why aren't we requiring the same of land travelers? If we are able to test Afghan peoples for COVID and vaccinate them not only for COVID, but measles, mumps, rubella, and polio, and other age-appropriate vaccinations which are required by the CDC, why is there a double standard along our southwest border? Do you agree with the IG's report? And the DHS did concur with 2 recommendations in that report, I believe. Do you agree that it's your responsibility to ensure that there are strong protocols at the border to mitigate the spread of COVID-19? Do you commit to implementing the IG's recommendations and identify ways to mitigate the spread of COVID-19? And do you commit to report back to this committee within a month on the progress the department has made at the border on testing for COVID-19? Thank you.
Congresswoman, may I seek your indulgence to obtain a transcript of all the questions that you've asked and answer them rapidly? I did not catch them all now. I will say, Congresswoman, that I do appreciate your focus on the communicable diseases with respect to migration, whether it's by air or by land, and in fact by sea. We have concurred in the Inspector General's recommendations. We have made changes to some of our COVID-19 protocols, and I will provide the requested information to you as rapidly as possible.
Well, Mr. Secretary, I appreciate your respect for the questions I asked, but I've been asking these questions since March, and we've seen no policy or protocol changes, and yet we see a totally different response for Afghan refugees coming to this country than we do for those along at our southern border. To include which this massive spending bill that is coming out and we're expected to vote on doesn't have adequate resources for CBP to do its job. So I thank you so much for your testimony. I expect that we will see changes in protocol and policy, and I'll reintroduce what legislation I can to force those changes. Thank you so much, and Mr. Chair, I yield back my time.
Gentlelady yields back. Chair recognizes gentlelady from New York, Ms. Rice, for 5 minutes. Chair recognizes gentlelady from Florida, Ms. Dimmons, for 5 minutes.